One of the most common questions you ask is it possible to reduce a hernia without a surgery? And here is a case when it was possible to do so. 6 months ago, the largest hernia out of 5. There were hernias in all the intervertebral discs. 6 months ago, it was 6 millimeters. This hernia will show you on the scan later. And now this hernia is only 2.5 millimeters. This is our patient, Anna Yurievna. And now she will share with you the secret of how she managed to deal with such a rather large hernia, for which surgery is recommended in almost 80% of cases. How did she manage? How did she achieve such success? She will tell us now. Your first treatment with us was in May 2015, correct?
I was here in September. I came to you on September 20th, and unfortunately I was here for only 5 days.
That's right.
And in May I had an MRI and saw that my muscle condition had worsened. In general, my back hurt a lot, so I decided to get another MRI to check, and that's when I saw that my condition had gotten worse. And before that, I completed 4 sessions at the Bobnovsky Center for my lower back intihuman. Yes, and then I went to see one of our specialists, a very good doctor, and he told me that I had been doing a lot of unnecessary exercises. That's forebending. Stretching it, sitting like this, and bending of the back. It turned out to be very harmful for me, especially with the pull. So I made all of this worse for myself, and they were much smaller before, but now I ended up with 0.6. By the way, I watched a lot myself. Well, I'll say this. The most important thing for me in treatment turned out to be physical therapy exercises and gymnastics. Because I watched a lot on YouTube and on the internet. To avoid spinal surgery, it was fear that motivated me before the operation. When I came back from Bubnovsky, they told me, we say you shouldn't go to Bubnovsky. So you'll come to us anyways, I was told. You have foraminal ones. I have 2 foraminal hernias. I checked here. I have 1 foraminal, but they've all actually gotten smaller. I used to have foraminal hernias, but you'll still come to us. And then, since I used to go to Bobnovsky's center, I read some of his books, in which he explains that even before a surgery, you need to prepare your back, your muscles, you need to prepare your muscles. They will cut them out for me, but as my muscles were damaged, at first, to be honest, I started preparing for the surgery. I thought, since they already said it, I would go to our neurosurgery center every month, and every month they would tell me surgery, surgery, surgery. And so I would leave again, they would schedule an appointment every month, and that was it. And then I started doing exercises. I watched your videos, Anton Vladimirovich. They were my salvation, really. I watched for 9 months. I watched you for 9 months. Yes, maybe more. I've been watching for a very long time, probably since your very first video.
Last year there was a video.
Well, there were just a few, very few. Well, I mean, I found you, and for the last 6 months, until September, I just kept watching and watching. Then when I started to get into all your explanations and clarifications, I watched all your videos on YouTube. I realized that only here could I get help, because I had been to vertebrologists and manual therapists. Like to all kinds of top specialists of different kinds. I also visited Tayumen, where they simply shrugged, stating it was a serious matter and I was unfortunate due to my numerous pre-existing issues.
So, to you?
I have osteochondrosis, so I couldn't use a lot of practices.
Did you feel any pain back then?
Yes, not exactly pain. I was lying down, and it's not just that I had issues with all my muscles here. There was a total imbalance. Yes, I was basically bedridden for half a year, and whenever I moved here. When I came here, well, I didn't know how everything would turn out. Unfortunately, it was only for 5 days, but that was in September when I called you.
Was it September 14th or 15th?
I arrived here and came for the procedure on September 21st. It must have been September 20th.
In 2014?
In 2015, and in 2015 I only did it in May. All my results are disappointing.
All right, I got it.
I realize that I won't be going into neurosurgery.
I remember you took this scan in May, right? And you came here in September.
I felt it was really hard for me, of course, and in general, I realized that I also watched it again in the summer. You already had more there. And about walking, the most comfortable way. Actually, you released a video about it in September, how to walk properly, to straighten your shoulders. I've already started following your recommendations by myself. I've seen that it started to work somehow, and I've realized that the most magical remedies for me are actually right here. And I have this list of my diagnoses, well, collected due to my age, you know. I thought maybe you wouldn't accept me here. I called your center, then they even handed the phone to you. I read out the whole list, and when you started attending me, I came here with joy. And already, well, even after the first conversation with you, your consultation, I realized how simple everything actually is. As they say, all genius things are simple. The way everything was explained to me, and here I have received so many recommendations, and then I left. Basically, during that period of time, I couldn't really do anything. My mobility was minimal, and I couldn't do any exercises at all.
Is that from May to September?
Yes, last summer I had extremely limited mobility. I was told I couldn't do this, I couldn't do that. Basically, I was in such a panic I didn't know what to do, how much I had harmed myself with the exercises, so I decided until I go there, I won't do anything. And then when you prescribed me the exercise in September, I started doing it right from the very first day.
So you've already...
The muscles started to get activated.
So you started to move, right? To do exercises?
It's not like I'm leaving here and all my muscles have gotten activated. I'm sick and limping. They put on taping to save me. I had connecting flights after all. But for me, now that I've arrived, every day for me, in 5 days, the procedure was done. And each session I was given 3 or 4 individual exercises. It's not like with a neurologist where they give you a handout, which honestly, the handout they give you in the office is for healthy people, half of them. So I found out that out of the 8 exercises recommended by all the neurologists, they have these templates ready there. There was only one that I could actually do with my osteoporosis, as they say, and now with my severe hernias.
Yes, at first you just needed to activate your muscles so that...
So I managed to do it. I kind of started working out. I thought, well, what if I have to have surgery? At least I'll get prepared, relax. If it's my fate to have this surgery, then I'll travel here, I'll get my muscles in shape, some muscles will relax, I'll strengthen others, so it'll be easier for me to get back on my feet later, because who's going to take care of me?
But in the end, it turns out you got treated here, right?
I've arrived and started immediately. After about 5 days at home, I had understood everything. I realized that I was flying on wings, that all of your exercises work. First of all, when I arrived, I came here on pills, on muscle relaxants, on antidepressants, on drugs that relax the muscles, on injections and painkillers. And now you told me to stop taking those pills, and on the second day I stopped taking them.
Well, there wasn't really any need for them.
I really didn't need them. I thought I would take a taxi, but I walked to the hotel.
So you got treated and then?
And there were such exercises, and I still kept doing the ones for my spine, strengthening my back. I kept working on my back. So I came back and I had 29 exercises just for me, personally selected for me, and I enjoyed doing them. Every day, 35 minutes a day. And sometimes I can do a specific exercise and I feel like I can do it for another 5 or 10 minutes during.
Well, so if you compare your well-being, for example, in May, let's say, well, last summer, right?
Last summer I already...
As of today. What changes are there now? So you're not taking any painkillers or any other medications anymore, right? So now you already...
The only thing is, since my nerves are very affected, the nerve roots, the only neuromedication I take is B vitamins.
Well, take them regularly.
Not regularly, only when needed, once every 3 months. We had prescriptions to restore because... Oh, that's it.
That's it.
And now here I am. Sergei Nikolaevich, your doctor, tested me, and he said that all my muscles, well, work differently.
Well, you see, it's good that you do this, that you do the exercises.
Because I realized that I don't want to have surgery if possible. I want to postpone it altogether. That's why the surgery... This is likely intended for people who fear of having a surgery. So the fear of surgery led me to realize that I could recover myself through exercises. With regular ones.
We recorded this video for those who ask if it's possible to cure a hernia and how to do it. Here, we're showing you the scans, and then you will see them in the picture. We're showing you a person who avoided surgery and recovered from a hernia. And here's some advice for everyone who asks, is it possible to cure a hernia without a surgery? A person who cured their hernia without surgery shares her experience.
You can reduce it significantly. You can make it smaller.
And in addition, what I'm about to say, this hernia, it was exactly the hernia, the biggest one we had, which was 6 millimeters, right?
Well, yeah.
So it was a hernia. That is the one with the rupture of the fibrous ring, when the nucleus pulposus went beyond the disc limits, and now it's already 2 millimeters. That's a protrusion. A protrusion is when part of the disc just bulges outward, but the integrity of the disc is preserved. So it has completely scarred over, and the integrity of the disc is fully restored.
People just need to understand that when you do gymnastics, your blood circulation increases significantly.
You have to.
And it's like it washed away this debris that came out, yes, and it was kind of washed away by the cerebrospinal fluid.
Your own sensations, yes?
Well, these are my sensations, yes. Even when I was doing it, I had the feeling that it was just washing it away.
Well, yes, basically what happens is that the outer part, which has already come out, the body itself starts to break it down. And during the treatment, we created the conditions.
And this needs to be sped up.
Yes, we create...
It might fall apart on its own.
It falls apart on its own. But a new portion keeps coming out all the time. A new portion keeps coming out again and again. And we create conditions so that this new portion doesn't come out. What has already come out has fallen apart.
First of all, you need to learn how to simply live. You also told me how to lift heavy things properly, how to get up, how to live.
The main loads.
The main loads, proper techniques, and self-care. And of course, I wish that the loved ones would take care of those with hernias and protrusions. And not just, you need to believe in yourself, that's one thing. And that it's possible. There's such a thing as the body healing itself, that we have our own human resources. Resources which are a gift that we need to properly activate.
Yes, to create the right conditions.
To create the right conditions, and with our own efforts. I didn't use any dumbbells and I didn't have any gyms. Everything was done with my own body weight, in a good mood, with good music. Get yourself in the right mindset for recovery. But how? At first I listened to what was going on and where.
You need the right mindset.
And then, of course, I already...
There's also a psychological factor here, like when you have a hernia, when everyone tells you that you need a surgery, it's scary. And if they also say that if you don't get it done, something terrible could happen. For example.
I'm just giving you this as an example.
That kind of fear.
Fear. And also, you just didn't know yet. I'll quickly say that I developed a cervical hernia. I had 3 hernias in my cervical spine. My hand used to get numb, and so did my fingers. And it took me 5.5 months to recover. Every day, through pain and tears, I did my exercises. They also told me, do the surgery, do the surgery. I had stenosis. 2 hernias had already come out. I had stenosis. So they also gave me exercises for that.
Of course, of course. The question is, what do we do during the treatment process?
Maybe someone is just being lazy, but I beg you, after the surgery, when I was sitting in line waiting to see the neurosurgeons, yes, waiting for my turn, I saw people in the corridors who had already had the surgery. And for whom this surgery didn't solve their problems, it actually made things worse.
Yes, it happens, it happens.
That's why I realized the further we get from the surgery, and it's just 30, even 20 minutes a day of your proper exercises.
But the most important thing is to choose the right exercises.
The main thing is that you get properly tested.
A person can't determine on their own which ones they should do.
If you have the opportunity, my dears, if anyone has the opportunity, come here.
No, you can't say it like that. They won't believe it.
They won't believe it?
We won't cut this out, but they'll say,
Well, you can cut it out, but just not advertising it. You can't please everyone. Because the main thing is to find a competent kinesiologist, I guess, so that most importantly they can test it.
No kinesiologist now.
Then who?
You simply need a doctor. Kinesiologists are common these days and the method is popular, and there are some of them like that.
Well, I just think I'm lucky that I found my doctors. I went through maybe a dozen or maybe even 24 doctors. When my family and loved ones were already saying, when will this end and when will you finally get some relief? And when I came back from you, even after 5 days in September, my daughter saw me and she said, Mom, it's like you went somewhere completely unknown, like you were in paradise. Everything changed, my mood, and I had a new mindset.
It's like a resort here.
I realize that I can get better, that's it, that I can improve my health, and it's all in my hands.
Thank you so much for sharing this with everyone, not just those who have doubts. Well, because people, why do they think that a hernia can't be treated? Because they're just not treating it the right way. See, if you do everything correctly, then all of this can be done. Please believe me.